Hello, my name's Shane Bruin. I'm from the College of Medicine and Dentistry at James Cook University. Thank you for joining me today. Today I'd like to speak to you about a very important clinical decision rule, that being the Ottawa ankle rules. Just some background first on ankle injuries. Ankle injuries are very common. They're very common presentations both in general practice and in emergency medicine. Most patients presenting with an ankle injury receive an X-ray series as part of their clinical workup. Although more than 90% of patients will not have a fracture. Subsequently, by X-raying these patients, we're exposing them to unnecessary radiation, and the cost to the health system is not insignificant. In 1994, Steele et al. Published a groundbreaking paper. They looked at what are the chances of a patient presenting with an ankle injury having an ankle fracture. So certain criteria were developed. Interestingly, this study had a sensitivity of 100%, meaning that if a patient did not fulfill the criteria, then they did not require an X-ray series because they did not have a clinically important fracture. So who does the rule apply to? The rule applies to patients who have sustained an ankle injury within the preceding 7 days, and to those aged between the ages of 18 and 55 years. So what does the Ottawa ankle rules state? They state that an ankle X-ray series is only required if there is any pain in the malleolar zone and any one of bone tenderness at the posterior edge of the distal 6 centimetres of the tibia, or bone tenderness at the posterior edge of the distal 6 centimetres of the fibula. Now it's important the entire distal 6 centimetres of each bone is palpated, or there is inability to bear weight for 4 steps both at the time of the injury and at the time of the examination. An important aspect to this is the patient needs to be able to transfer weight twice onto each foot, but limping doesn't count. It's okay if they limp, that's classed as bearing weight. Patients who present with ankle injuries, as part of their focused examination, we should also examine their foot. Subsequently, we may also decide to X-ray their foot if they fulfill certain criteria as outlined by the Ottawa ankle rules. So a foot X-ray series is only required if there is any pain in the midfoot zone and any one of the following: bone tenderness at the navicular, or bone tenderness at the base of the 5th metatarsal, or inability to bear weight for 4 steps both at the time of the injury and at the time of the examination. Like with the ankle component of the rule, limping doesn't count. As with any clinical decision rule, clinical judgment must always prevail. We need to look at the study and see who were excluded from the study. From the Ottawa ankle rules, pregnant ladies were excluded from the study, so we don't know if this rule applies to them. Subsequently, we don't apply this rule to pregnant ladies. Our clinical decision may be clouded by patients who are intoxicated, uncooperative, or have an altered level of consciousness. They have other painful, distracting injuries. There's diminished sensation in the region we're examining, or there's gross swelling preventing us from palpating the region accurately. Subsequently, we need a lower threshold in imaging these types of patients. Thank you for your attention. I hope you've gained something from looking at the Ottawa ankle rules. I hope this helps you in your clinical decision-making process as to which patients require an ankle and/or foot X-ray series after presenting with an ankle injury. Thank you.